Okay, really excited to get started with Charles. Our first speaker is Charles Vidich, who served as the Unified Incident Commander for the anthrax bioterrorism events unfolding across the nation in 2001. In 2003, he was appointed a visiting scientist at the Harvard School of Public Health, and later the Harvard Humanitarian Initiative, where he lectured on communicable disease and quarantine and completed research on his recently published book, Germs at Bay, Politics, Public Health, and American Quarantine. He holds 2 graduate degrees from Harvard, a master's in city planning and a master's in environmental health from Harvard School of Public Health. His environmental work has been recognized by several American presidents. Without further ado, Charles Vidich is going to talk to us about using unified command during public health emergencies.
Well, thank you. It's a pleasure to be here. Before I get into this, I should say a few words about the anthrax response. There really wasn't a unified command when it started. Everybody was trying to cobble something together. The first time in our history that we had a bioterrorism response of this magnitude, affecting every household in America that received mail. It was from that process that we did develop a unified command, and partly because it was a bioterrorism event that was a national security issue and a national crime scene at the same time, as well as a public health initiative. So because of that, there was a unanimity of action that took place. I think she's working on a few things, but do not get disturbed by what's going on up there. So the point of this is that in order to understand the predicament we're in today, and I know you all understand the predicament we've been in with COVID-19, it's good to understand how unified response can work, not how it has been working. So we're going to go through this a little bit here. So I'm going to talk about what it is, what is unified command response within the context of emergency powers. Those are those that are granted to the 50 governors and the president. And of course, how do you apply a unified response, when you do it, and what are the key parameters that make it work? And then a few suggestions about how this will apply to the current condition or future ones like we have with COVID-19. Well, let's try another one. So unified command approach is a structure that brings together incident commanders of all major organizations involved in the incident in order to coordinate an effective response, while at the same time allowing each to carry out its own jurisdictional, legal, functional, and geographic responsibilities. That's not what's going on right now. We have a very different world, and it has to be understood too that unified response is not incident response. Incident response is when a local fire department goes to a fire and puts out the fire, and it's all within their chain of command. That's the easy thing, and that's what's been going on with very few exceptions. Let's try. So what are the 2 basic problems that I see? One is the reliance on executive orders, not consensus making, to establish the future where we're going. For those who don't know, there were 3,856 executive orders issued as of about a week ago, because I've been tracking this whole phenomena. Of those, of course, there's a very limited number of them that actually deal with public health, but not a very small number, as in just with face masks that we'll get into. 460 executive orders exclusively dealing with face masks across the country, Puerto Rico and the District of Columbia. So we're a democratic society. The last time we had a king was what, George III, I believe. And executive orders are like king's declarations. Doesn't quite fit a society of ours, which is really a rebel-based society. So there is an issue here in terms of how that fits. If the shoe fits, wear it, they say, but this may not be a good fit. The other part of our problem is unified command. And we've not seen unified command. We've seen 50 states all doing their individual things. So when that happens, everyone's in charge, it means that no one really is in charge. So here's an example. This represents the work of 2.5 years that I put together. I could give a 5-hour presentation about what's going on in the executive order. This is a short little couple snippets of it. There's 9 different circles that fall within the face mask yellow color there. But on top of all these Venn diagrams, you have the public spaces and you have the private spaces. Then is it a crowd size issue? Is it a social distancing issue? Are you sharing space, public or private? Try putting all those together, asking anybody on the street what they think of these things. I'm sure you can gather that this was not put together by Madison Avenue advertising executives. So that's one of the consequences. So an important thing to understand is an emergency powers, that's what the governors have been given. They're the enablers. They're not the responders. However, you probably have noticed that has been a little bit of a fuzzy area. So the key is here is when the governors enable this and they step aside and let the people who know how to respond with the technical expertise, that's what makes the difference. We saw all kinds of leading edge work going into bleeding edge work where people are stepping over their responsibilities as governors. That has been part of the problem. And obviously the failure to coordinate leads to all the things that you see on the slide. Loss of life, loss of resources, and of course, time and money when people are stepping on each other's areas of responsibility. So let's just talk about emergency powers first. 2 basic things that they provide. One is they put all the laws aside temporarily that may be standing in the way of doing things. And the other is they activate all kinds of resources. Those are 2 key things that they do. The disadvantage of this is that the emergency powers do not enable effective incident management. There is no, if you read the statutes of all the 50 states, they do not deal with this issue of how to deal with incident command. They just say, okay, we have an emergency. So this is the part that is the fuzzy area where we need more work. And of course, multi-jurisdictional approaches require planning and coordination. And of course, every one of the 50 states has a boundary around it. But the last I heard, COVID is not stopping at the boundary lines. It's going right through. So, and of course, large scale incidents can't be handled in a silo management fashion. We see that at all levels of government. So this requires a culture change. So what makes it work? Well, first of all, I guess we're going to have to educate our elected officials. They have a much more limited role in terms of the actual on the ground level. However, that's not what's going on. They do have the responsibility for giving us a broad mission statement. It says, here's your mission statement, get it done in 30 days and or extend it if you can't get it done in 30 days. That's how it's going. 21 days, 30 days, they keep on going. Right now we have 18 states that are still in the so-called emergency powers status, largely because of the funding opportunities. A big thing here is the government can't do this by itself. That's a huge part of this problem, is coordinating the private and the public sectors. And of course, we all know the plans were not done the night before. They were done once a year, but they were the wrong plans. So the flexibility factor obviously has to be considered here. And we weren't bringing in all of the key people. We know bioaerosol issues were not being dealt with properly. We know that the people who understood the efficacy of face masks from all the work done in 2001, 2003 with SARS, it wasn't getting integrated. So there's a lot of good opportunities. And one of the important things is when you work in unified command, there's no cult personality here. It's a matter of working together. That's not always easy to do, but that's what the key is if we're going to make this work. So when do we use unified command? There's 4 basic reasons. The 5th is one that we need to add to the basic structure of all unified commands, and that's consistent communication. But basically, multiple geographies, multiple functions, multiple governmental levels, and multiple statutory authorities. Those are the 4 basic reasons that you use to develop a unified command. And that's not easy because everyone's in their own little silo. That means stepping out of it. That's a huge culture change that we're going to have to make it work. So obviously the consistent communication strategies, it's pretty hard to do that when you had 3,856 executive orders, all going in so many different directions. Some saying you must vaccinate, some say we don't care if you vaccinate, some say we don't want you to have a passport for vaccination. It was all over the place. This is a perfect recipe for a great after-action report. So what could we do in terms of future pandemics? Would it work? The answer is absolutely. Nothing else will work until we get to a unified command structure. One of the most important things that I haven't mentioned yet is that the experts in this field are the U.S. Forest Service. And you say, why the U.S. Forest Service? Because they fight wildfires. Last I heard, wildfires do not follow county, municipal, or state lines. And the result is that they have the best system, unified command. When we did the anthrax response, we brought them in and they educated us about how to do it. And that's a key thing, is bringing in those who know how to do this. And it's only in complex emergencies that you need unified command. For a simple emergency, the fire at a house down the street, that's an incident command structure, not a unified one. But a key thing for closing this out is there is a disconnect between emergency powers and the unified command. We have to disconnect them. I should say they're an issue here in that the emergency powers cannot be considered unified command. It has to be separated in the sense that unified command is not based on the edicts of a governor, because the governor cannot talk about the adjoining locations outside of his jurisdiction. And even within a state, if all of the parties are not working together, then you're not working towards a common purpose. So I do believe that there may be a need for a new emergency public health structure to deal with these issues. Our country had a national public health program in 1883 for a few years, and it went kibosh, and I won't go into the reasons for it. Because of that, we have a very distinct difference between many countries that have a much coordinated national system. But even if you have that system, unified command is critical. It means you have to get the coalescence of the people who are responsible for every aspect of an emergency to be working in the same room. And if not in the same room, in the same Zoom room. So those are the things that it takes to make it happen. And I believe that for those who are really interested, I put together a one-page bibliography, which I can hand out to you later for those who are interested in how we can use unified command for the next pandemic.